This time 6 years ago, the COVID pandemic was unfolding with cases of the virus spreading around the world. The independent review into the handling of the pandemic here is due to deliver its final report before the end of the year. Review chairperson Professor Anne Scott has been speaking to our health correspondent Fergal Bowers, who began by asking her to explain her remit.
Obviously, Covid-19 pandemic was one of the most significant national crises in recent history. And I guess the evaluation has been tasked with looking at how the government prepared for, planned and managed the pandemic. We're also looking at the impacts of the pandemic and that management on society, on people, individuals, communities, etc.
And in May last year, you held the launch of a public consultation, and I think you got maybe over 7,000 responses from members of the public about their experiences. Can you give me a flavour of what themes came through from that?
The three key things that people who responded were concerned about during the pandemic was mental health and well-being, relationships, social connection and community, and physical health. But interestingly, in terms of the most negative experiences for the people who responded, it was around areas like civil liberties, human rights, maybe trust. If you look specifically at parents and young people, by far the most significant issue of concern to them was actually education and development. And I think one of the things that is clearly recognised in a number of the responses and indeed a number of the stakeholder submissions is the important role of schools not only in academic development but also in social development. So for example, children and young people in general are pointing to not only concerns with the disruption of education but also the concerns with disruption of their social development.
How do you plan to understand the impact on bereaved families when people were unable to visit their loved ones?
I think it's absolutely the case, as you said, that many people were highly traumatised by both the visiting restrictions, but particularly restrictions which meant that they couldn't spend time with their loved ones in the last days of their life. And I think the disruption also of funerals, having very, very few people attend burials, has been very traumatic with some people. And in a number of the individual submissions we've received, people would say they are living with this will never go away. We are also offering private listening sessions for the bereaved, so people who suffered bereavement of a loved one in the nursing homes during the pandemic are invited to come to a number of these sessions in February, March kind of time.
And in relation to civil liberties, campaigners, say new laws and health measures were brought in haste, they would say, with very little time for scrutiny, and that people's ordinary lives were affected on a day-to-day basis. That's a major issue for this evaluation to look at, isn't it?
In an emergency situation, emergency measures have to be taken, and the protection of health is a key right for people in society, and therefore in this context protection of health was the high priority. But I think as the pandemic evolved and as our response to the pandemic evolved, we do need to look carefully to make sure that human rights were supported rather than infringed and the civil liberties were supported. So yes, we will be doing that.
How can you reassure people who think you just don't have the teeth and the power to get to the truth?
I can absolutely assure people that no government department has refused to produce anything we've looked for. One of the benefits of an evaluation approach is that it's a non-confrontational approach. It allows us to work collaboratively, it allows us to work in cooperation.
And when would you expect to produce a final report for government?
We were tasked with completing the work within an 18-month period, and we are very much working towards producing the report towards the end of the year.